Welcome to the Ministry of Health's weekly review. Stay with us as we recap the past week events and initiatives. On Wednesday, June 12th, Honorable Minister of Health Dr. Frank Anthony commissioned a telemedicine site in Waramuru in Region 1. In his remarks, Minister Anthony stated that there are currently 25 telemedicine sites around Guyana, and in the next few months, 25 more telemedicine sites will be added. Following this, Dr. Anthony visited the residents of Karaburi to discuss health-related concerns within the community. On Friday 14th, the Ministry of Health formalized a memorandum of understanding with several private opticals and hospitals in anticipation of the launch of the Government of Guyana's eye testing and spectacles program and the cervical cancer screening program. These initiatives underscored the government's commitment to enhancing healthcare quality and ensuring all citizens have access to crucial services. On Saturday 15th, the Ministry of Health's National Blood Transfusion Service hosted a ceremony to commemorate World Blood Donor Day under the theme 20 Years of Celebrating Giving. Thank you, blood donors. The ceremony aimed to raise awareness about the significance of blood donation and recognize frequent blood and plasma donors, as well as organizations involved in donation drives over the years. In his remarks, Dr. Anthony noted that the blood transfusion unit achieved its highest donations last year. He also emphasized the ministry's expansion of blood bank hubs across the country, moving away from centralization in Georgetown. The minister also explained that donated blood is screened for infections before transfusion. Also, on this day, an appreciation ceremony was held for healthcare workers who participated in the Madia fire response. This ceremony recognized the exceptional efforts of healthcare workers after the devastating Madia Dorm fire in May 2023, where 20 lives were lost. The ceremony underscored their dedication, bravery, and selflessness during the crisis. While delivering remarks, Honorable Dr. Anthony stated that everyone made an extra effort in responding to the emergency and commended them for their remarkable work. Dr. Anthony also emphasized that the ministry implemented telemedicine at 4 sites in Madia to ensure quality health care during the emergency.
We also went in during all of that and we put telemedicine in 4 of the sites so that we can communicate with people, we can talk to people, we can make sure that whatever issues they are having, we had a way of communicating with them. And that was a different element that we added.
The Ministry of Health's Food and Drug Department, in collaboration with PAHO WHO, commenced a 3-day workshop on June 18th with special focus on technical cooperation in pharmacovigilance, market surveillance, and control. In addition to these activities, 31 persons from Regions 3, 4, 5, and 7 graduated from the Ministry of Health's Community Health Workers Training Program. The 8-month training program provided the graduates with essential skills and knowledge in areas such as autonomy and physiology, logistic management systems, disease surveillance, pharmacology, and maternal and child health. During his remarks, the minister emphasized the importance of serving patients with a positive and kind attitude and highlighted the significance of providing excellent care and treatment to all who visit health facilities.
You know, it's easy to build a health center, it's easy to equip it, but the hardest part is to have people with the right attitudes in the facility. And very often, while we make millions and sometimes billions of dollars in investments, if when people come to the facility and they're not treated properly, then that's the impression they will leave with.
On the said day, the Ministry of Health successfully launched the government's eye testing and spectacles program, catering for anyone under 18 years of age and persons 65 years and older. Persons requiring an eye test can utilize a voucher valued at $2,000 at selected opticals countrywide. If the patient requires spectacles, they can uplift another voucher valued at $15,000 to cover the cost of the spectacles.
We recognize while we have capacity in the Ministry of Health, we would not be able to screen so many people at one time with our facilities. So we have enlisted the help of the private sector, and we've had some meetings with the private sector, all those who are licensed to be able to do screening. And we have done that evaluation of them. And just last week, we were able to meet with them. They signed a contract with us, and that contract would allow them to partner with the Ministry of Health, with the government of Guyana, to make sure that they will provide screening.
This is the end of the Week in Review. Thank you for staying tuned. Remember to take advantage of our eye testing and spectacles program. Until next time, stay well.